Osteoarthritis is a degenerative joint disease causing pain, swelling, and reduced movement in joints. It commonly affects the knees, hips, spine, and hands, predominantly in individuals over 55 years old. Risk factors include aging, gender, obesity, and previous joint injuries. As of 2019, approximately 528 million people worldwide were living with osteoarthritis, a 113% increase since 1990. In the United States, about 53.2 million adults have arthritis, accounting for 21.2% of the adult population. Since this disease is very common, we recommend watching this video until the end to make sure your loved ones stay healthy now and in the future. 1. Joint pain, the most common symptom of osteoarthritis. Joint pain is one of the most common and earliest symptoms of osteoarthritis. This pain usually worsens when moving the joint or after physical activity. In the early stages of the disease, the pain may be mild and occur only in specific situations, such as after exercise or prolonged use of the joint. As osteoarthritis progresses, the pain becomes more persistent and may even be present at rest. This pain occurs due to the gradual breakdown of joint cartilage, leading to increased friction between bones. To reduce pain, methods such as light exercise, applying hot or cold compresses, and taking anti-inflammatory medications as prescribed by a doctor can be helpful. 2. Joint warmth and redness in osteoarthritis. One of the less commonly discussed symptoms of osteoarthritis is joint warmth and redness. This symptom occurs due to inflammation within the joint and is typically observed in the later stages of the disease. As the cartilage in the joint wears down and bones start rubbing against each other, the body triggers an inflammatory response, increasing blood flow to the affected area. This increased blood circulation can make the joint feel warm and cause the skin around it to appear red. Although this symptom is not as severe in osteoarthritis as in inflammatory conditions like rheumatoid arthritis, it can still lead to discomfort and increased joint sensitivity in some individuals. 3. Joint popping or grinding sound in osteoarthritis. A common symptom of osteoarthritis is a popping or grinding sound in the joint, known as crepitus. This occurs due to the breakdown of joint cartilage, which increases friction between bones. Normally, healthy cartilage ensures smooth and silent joint movement, but as osteoarthritis progresses, the joint surfaces become rough, leading to these unusual sounds. Crepitus is most commonly observed in the knees, neck, and fingers. If the popping sound is accompanied by pain, it may indicate significant joint damage. To manage this condition, engaging in gentle exercises, taking joint supporting supplements, and reducing strain on the affected joint can be helpful. 4. Night pain in osteoarthritis. One of the common issues for people with osteoarthritis is night pain, which can interfere with sleep. This pain is usually caused by joint inflammation and bone friction due to cartilage deterioration. During the day, joint movement helps produce synovial fluid, which lubricates the joints, but at night, reduced movement can lead to increased stiffness and pain. Additionally, sleeping in improper positions may put extra pressure on the joints, worsening the discomfort. To alleviate night pain, using supportive pillows, maintaining a comfortable room temperature, and performing gentle stretches before bed can be beneficial. 5. Joint deformity in osteoarthritis. In the advanced stages of osteoarthritis, joint deformity can occur. This happens when the cartilage is significantly worn down, causing abnormal bone friction. As a result, the joint may become misshapen, bony outgrowths may develop, and in some cases, normal joint movement may become impossible. This condition is most commonly seen in the hands, knees, and feet. Joint deformity not only affects physical appearance but also leads to pain, reduced range of motion, and functional difficulties. Early treatment includes physical therapy, strengthening exercises, and anti-inflammatory medications. In severe cases, surgical procedures such as joint replacement may be necessary. 6. Joint locking sensation in osteoarthritis. One of the sudden symptoms of osteoarthritis is the sensation of joint locking. This occurs when pieces of cartilage or bone become detached and remain inside the joint. These fragments can cause interference with the joint's movement, leading to the feeling of it getting stuck or locked. This condition is commonly seen in the knees, finger joints, and shoulders. When the joint locks, its movement becomes severely restricted, and in many cases, individuals may need to consult a doctor to resolve the issue. Now, when it comes to discussing the treatment of this disease. 1. Using hot or cold compresses for osteoarthritis treatment. One effective method for reducing pain and inflammation in osteoarthritis is using hot or cold compresses. This simple and accessible technique is widely recommended for alleviating osteoarthritis symptoms. Cold compresses are typically used to reduce inflammation and swelling in the joints, especially when the joint has become inflamed due to excessive movement or injury. Applying an ice pack or cold compress to the affected area can help reduce blood flow and limit inflammation. On the other hand, hot compresses are beneficial for easing chronic pain and joint stiffness. Heat increases blood flow to the joint and relaxes surrounding muscles and tissues, which can relieve pain and improve joint flexibility. These methods can generally be effective alongside other treatments like medications and physical therapy. It is recommended to use these treatments for short periods and at specific intervals to avoid any potential harm or overstimulation. 2. Physical therapy in osteoarthritis treatment. Physical therapy is one of the main and effective treatments for managing osteoarthritis. The primary goal of physical therapy in osteoarthritis is to improve joint mobility, reduce pain, and strengthen the muscles surrounding the affected joint. Physical therapy treatments include a variety of strengthening exercises, stretching techniques, and manual therapy to increase the joint's range of motion and reduce stiffness. This method is especially beneficial for joints like the knees, shoulders, and lower back. Physical therapists can design specific exercises to improve muscle strength and joint flexibility. These exercises not only help reduce the pressure on the joint, but also prevent further progression of the disease. In addition to exercises, physical therapy treatments may include manual techniques to improve joint alignment, local heat or cold therapy, and electrical treatments. Physical therapy can generally help manage osteoarthritis effectively when combined with other treatment options, such as medications and supplements. 3. Light exercise in osteoarthritis treatment. Light exercise is one of the best methods for managing osteoarthritis. Engaging in regular physical activities can help reduce pain and improve the range of motion of the joints. Activities like walking, swimming, cycling, and yoga can strengthen the muscles around the affected joint and reduce the pressure placed on it. By doing these exercises, muscles gain strength, providing better support for the joint. Additionally, light exercises can help maintain joint flexibility and prevent stiffness. For individuals with osteoarthritis, performing exercises in water can be particularly beneficial, as the water reduces body weight and puts less strain on the joints. Exercise not only helps reduce pain but also brings a general sense of well-being and improves the quality of life. However, it's important that the exercises are done correctly and under the supervision of a physical therapy specialist to avoid further injury. 4. Pain relievers in osteoarthritis treatment. Pain relievers are a common method for managing osteoarthritis symptoms. These medications can help reduce joint pain and improve the quality of life for individuals with osteoarthritis. One of the most commonly used pain relievers is acetaminophen, which is effective for mild to moderate pain. It is typically used for temporary and short-term pain and has fewer side effects compared to nonsteroidal anti-inflammatory drugs. On the other hand, NSAIDs like ibuprofen and naproxen are more effective for more severe pain and joint inflammation. These medications work by reducing inflammation, which in turn alleviates pain. NSAIDs are usually taken orally or applied topically. In cases of chronic and intense pain, a doctor may prescribe stronger painkillers or opioid medications. In addition to pain relievers, joint supplements such as glucosamine and chondroitin can also help reduce pain and support joint cartilage. 5. Weight loss in osteoarthritis treatment. Weight loss is one of the most important factors in managing osteoarthritis, especially in weight-bearing joints such as the knees and hips. Excess weight puts additional pressure on the joints, which can increase pain and inflammation in joints affected by osteoarthritis. When an individual loses weight, less pressure is placed on the joints, which in turn reduces pain and improves joint movement. Studies have shown that even modest weight loss can have a positive impact on reducing pain and improving joint function. Additionally, weight loss helps strengthen the muscles surrounding the joint and prevents further progression of the disease. For effective results, weight loss should be combined with a balanced diet and a regular exercise program. Walking, swimming, and cycling are among the activities that can help manage osteoarthritis while losing weight. Now we reach one of the most crucial parts: preventing osteoarthritis. In this section, we will explore methods and strategies that can significantly reduce the risk of developing this condition and help maintain the health of your joints. 1. Maintaining a healthy weight to prevent osteoarthritis. One of the best ways to prevent osteoarthritis is by maintaining a healthy weight. Excess weight puts significant pressure on the joints, especially weight-bearing joints like the knees, increasing the risk of developing osteoarthritis. When body weight is controlled, the pressure on the joints decreases, which helps reduce pain and inflammation. Even a modest amount of weight loss can have a positive impact on joint health. In addition, maintaining a healthy weight contributes to overall body function and increased energy levels. To achieve this, incorporating a balanced diet and regular physical activities, such as walking or swimming, into daily routines is recommended. 2. Regular exercise to prevent osteoarthritis. Regular exercise is one of the best ways to prevent osteoarthritis. Physical activity helps strengthen the muscles around the joints, reducing the pressure placed on them. Exercises like walking, swimming, and cycling are beneficial not only for strengthening muscles but also for maintaining joint flexibility. Regular workouts improve joint movement and prevent stiffness and pain. Exercise increases blood circulation and reduces inflammation in the body, which helps maintain overall joint health. In general, regular physical activities can prevent osteoarthritis from developing in later years and improve quality of life. 3. Strengthening muscles around joints to prevent osteoarthritis. One effective method to prevent osteoarthritis is by strengthening the muscles around the joints. Strong muscles provide support to the joints and reduce the pressure placed on them. By strengthening muscles, joints are less exposed to injury and will function better. Exercises to strengthen the muscles of the thighs, lower back, and shoulders, in particular, can protect the joints in these areas. Muscle strengthening not only helps prevent osteoarthritis but also improves joint mobility and flexibility. These exercises are especially important for individuals at higher risk of joint injuries. Regular strength training can help maintain joint health and prevent the progression of osteoarthritis. 4. Avoiding sports injuries to prevent osteoarthritis. Avoiding sports injuries is one of the key ways to prevent osteoarthritis. Repeated joint injuries, especially in high-impact sports or when proper protective equipment is not used, can increase the risk of developing osteoarthritis later in life. Using appropriate gear like knee pads, elbow braces, or helmets during physical activities can help prevent joint injuries. Additionally, warming up and stretching before exercise, along with employing proper movement techniques during workouts, can reduce the strain on joints and prevent injuries from improper movements. Preventing sports injuries, especially at a young age, can protect the joints and prevent the onset of osteoarthritis in later years. 5. Wearing proper footwear to prevent osteoarthritis. Wearing proper footwear is one of the most important steps in preventing osteoarthritis. Improper shoes, especially those that do not provide adequate support for the foot and its arch, can place significant pressure on the lower body joints, particularly the knees. This extra pressure can lead to pain and inflammation in the joints over time, eventually resulting in osteoarthritis. Shoes with proper arch support, soft insoles, and adequate cushioning for walking or daily activities can help reduce stress on the joints. Additionally, choosing shoes with a reasonable heel height, not too high or too flat, can prevent joint problems. By selecting the right shoes, you not only prevent osteoarthritis but also improve foot comfort and overall health. 6. Maintaining a healthy diet to prevent osteoarthritis. Maintaining a healthy diet plays a significant role in preventing osteoarthritis. A nutrient-rich diet helps maintain joint and bone health and can prevent joint inflammation. Foods rich in omega-3 fatty acids such as fatty fish and anti-inflammatory foods like leafy greens, berries, and nuts can help reduce inflammation. Additionally, vitamin D and calcium are essential for bone health. Consuming calcium-rich foods like dairy products and leafy greens, as well as vitamin D sources like sunlight and fish, can help prevent osteoporosis and joint problems. Furthermore, it is important to avoid processed foods high in trans fats and sugar, as these can increase inflammation and worsen joint damage. 7. Avoiding prolonged sitting to prevent osteoarthritis. Avoiding prolonged sitting is one of the key strategies for preventing osteoarthritis. Sitting for long periods, especially in static positions, can put pressure and stress on the joints, leading to stiffness and pain. To prevent these issues, it is important to stand up and move around every 30 minutes. Even simple movements like stretching, rotating your body, or taking short walks can help reduce the pressure on the joints. Additionally, if you have to sit for extended periods, using ergonomic chairs and changing your body position can help relieve joint stress. By following these tips, you can prevent joint problems like osteoarthritis and contribute to your overall joint health. By following preventive measures and caring for your joints, you can reduce the risk of osteoarthritis and improve your quality of life. I hope this information has helped you protect your joint health through various methods. Always prioritize your health and seek medical advice if necessary. Wishing you and your loved ones health and well-being. Goodbye.